Welcome to the Patient Assessment Medical. For this scenario, you will be tested on your ability to treat and interview a patient. Please verbalize any procedures that you perform and any conditions that you find on the patient. You will have 15 minutes to assess the patient. Go ahead and familiarize yourself with the equipment provided. You are dispatched to a single-story residence for a 24-year-old female complaining of abdominal pain.
Alright, BSI, scene safety. I got my PPE on. Is my scene safe?
Your scene is safe.
Okay, so I'm going to go ahead and do my e-names. Environment, I'm at a residence. Do I see any environmental hazards?
No hazards noted.
Okay, number of patients. I see one. Do I have any other patients?
Just the one.
Additional resources, I'm going to consider them at this time. I'm not going to summon them yet. I'll call them based on the situation. Okay, so this seems like a nature of illness since the patient is complaining of abdominal pain. Extrication, do I have easy access from the ambulance to the patient?
Easy access.
Alright, so for the C-spine, I don't think we're going to need stabilization of C-spine since this is a medical call. Alright, so I'm going to go ahead and form a general impression of the patient. So the general impression, I see my patient just sitting on a chair, kind of hunched over, guarding her abdomen. And I'm going to go ahead and check the APCU. So my patient is tracking me right now. Hi, ma'am.
Hi.
All right, she is talking to me too, so I'm going to assign A on the APCU scale, and I'm going to go ahead and check the ANO status. Hey, ma'am, my name is Kay. I'm the EMT. I'm here to help you today. What's your name?
My name's Devin.
All right, do you know where you are?
Yeah, I'm at my house.
What year is it?
It's 2020.
So what seems to be the problem today?
I don't know, my stomach's just really hurting.
Okay, so my patient is ANO4, so I'm going to go ahead and do my ABCs. For the airway, my patient is talking to me, so the airway is open. And for breathing, I'm going to assess for the chest rise, and I see equal and adequate chest rise. So I think the patient is getting adequate ventilation, but I'm going to go ahead and give her some oxygen at 6 liters nasal cannula. So I'm going to set up my O2 tank. Alright, let me just hang this around the neck.
Okay.
Alright, so I'm going to move on to my circulation. I'm going to check for the pulse. What's the rate and rhythm?
You feel a slightly fast pulse with an adequate strength and an even cadence.
Okay, good. I'm checking the skin signs at the same time.
Skin signs are warm, they are pink, and diaphoretic.
Okay, and do I notice any major bleeding?
No bleeding noted.
Okay, so I'm going to go ahead and make a transport decision. I think the patient is stable right now, so we're just going to decide to stay and play. All right, so I'm going to go ahead and do my history taking. So I'm going to start with OPQRST, and so ma'am, how quickly or slowly did this pain come about?
Well, it started this morning, and then it's gotten a lot worse since then.
And does anything make it feel better or worse?
Leaning over like this and putting pressure on my stomach kind of helps, but as soon as I move, it really hurts.
Okay, and how would you describe this pain?
It's really sharp.
Okay, and is it moving anywhere, or is it just staying there?
No, it's just primarily in this part of my abdomen, and it kind of moves to my right shoulder too.
Okay, and on a scale of 1 to 10, how bad is the pain?
It's about an 8 right now.
Okay, and how long ago did this happen?
Maybe like 6 or 7 hours.
Okay, so that was my OPQRST, and I'm going to move into sample. All right, so for signs and symptoms, my patient is complaining of abdominal pain. She pointed it to the lower right quadrant of the abdominal area. And for clarifying questions regarding signs and symptoms, so you said it came about in the morning, and it was pretty quick?
Yeah, like I woke up with it, and then I thought it might pass throughout the day, but then it's just gotten worse since then.
Okay, and do you have any allergies?
I'm allergic to penicillin.
Are you taking any medications right now?
I just take vitamins every day.
Vitamins, okay. And do you have any past medical history that I should be aware of?
No, not really.
Okay, and when and what did you last eat?
I last had a salad about 2 hours ago.
Okay, and what were you doing when this started?
I was just resting because it's been bad all day and it really hasn't gotten better.
Okay, so that was my sample. So I'm gonna go ahead and do my secondary assessment. Since my patient is complaining of abdominal pain, I'm gonna palpate the abdominal area. And you said it was in the lower right quadrant?
Yeah, it feels like it's like right here.
All right, so I am going to start from the upper right quadrant. Just palpating, moving to the left. All right. And what do I feel?
On the lower right quadrant, you feel rebound tenderness.
Okay, rebound tenderness. All right, so I'm going to go ahead and take my vitals, starting with blood pressure. Could I have this one, please?
Sure.
I'm going to roll up the sleeves, okay?
Okay.
The blood pressure you got on your patient was 132/94.
132/94. All right, I'm going to go ahead and check the pulse and respirations as well.
For pulse, you feel a rate of 102 beats per minute. For respirations, the patient is at 24 respirations.
Okay, so I'm going to go ahead and form my field impression. My patient is complaining of abdominal pain that is in lower right quadrant, and she described it as sharp pain that is 8 out of 10. And when I palpated, I felt rebound tenderness, and so I think this is appendicitis. And I'm going to reassess this patient every 5 minutes. And the interventions I did for this patient is I just gave oxygen at 6 liters per minute nasal cannula. And we're going to go ahead and transport now. Are we at the hospital?
Yes, we're at the hospital.
Okay, so I'm going to go ahead and give my verbal report to the receiving nurse. All right, so we have a patient who is 24 years old, female, complaining of abdominal pain that started this morning, which progressively got worse. Patient described the pain as a sharp pain, which is 8 out of 10. And when I palpated, I felt rebound tenderness in the lower right quadrant. And the last vitals we got was 134/92, 102 pulse, and 24 respirations. And we gave oxygen to the patient at 6 liters nasal cannula. Would you like to know anything else about this patient?
No, thank you.